Good morning, everyone. Our topic today is COVID-19 and the respiratory illnesses. We are pleased today to have with us Professor Çuhadaroğlu. He's a specialist in chest disease. He's the physician-in-chief of Acıbadem, Altunizade Hospital. He's also consultant to the Turkish Ministry of Health. His main focus are sleep disorders, allergy, clinical immunology, smoking disorders, COPD, asthma, and lung cancer. Hi, doctor, how are you? We are so glad to have you with us today.
Thank you. Thanks for your invitation.
So, as we all know, COVID-19 is a respiratory disease caused by SARS-CoV-2 virus. First, we want to know how is it transmitted? We know that it has been detected in blood and stools. Could there be another way of transmission?
We learned this disease from China, and 6 months ago we have some knowledge for transmission, but nowadays we know some new things. We should update our knowledge every day. This is a droplet infection. What's a droplet? The virus just spread from upper airway, from nose and also from mouth. If you are talking a lot or sneezing or coughing, the droplet with virus just spread the air. If anyone take these droplets with mouth and nose and also eyes, because eyes has a channel between eyes ball to nose space, and you can take virus and the disease transmitted to other. Mm-hmm. But we haven't got any evidence that blood or stool is a transmission way. Mm-hmm. Yes, we found the virus in blood, and also we find the virus in stool, but finding the virus somewhere is different from the power of transmission. Okay. Because for transmission it should be large amount of virus, live virus, mm-hmm. and it depends to patient immunologic status. In mm-hmm. short, this is an airborne disease. The transmission from blood and stool is not confirmed.
Okay, so we are now in the summer season. So do you think is it safe for people to go to the beach, to use pools, spas? Do you think there's a chance of spreading the disease through water, for example? Sea water or pool water, or
we are talking about social distance in many times. Mm-hmm. So first, in beach and also in sea or pool, if you protect your social distance, I mean 1.5 meters or 2 meters, there is no risk. Mm-hmm. Because we know that this disease is not transmitted from water, mm-hmm. especially salty sea water. Okay. And because of this reason, you are safe. But if you lose your social distance in sea, the transmission is similar with street. Uh-huh. And everyone asks about what about summer? What about hot, warm weather? Weather maybe kill the virus. Mm-hmm. It's true, but if someone cough or sneeze just in the 1 or in 2 meters, mm-hmm. even there is sunshine, the virus can be transmitted to other. But we know that ultraviolet rays, I mean sunshine, for example, can easily kill the virus. Mm-hmm. and the risk is decreased. But with a patient with cough and sneeze, there is no time to kill virus by sunshine. So we have some epidemiologic data in countries on the equator side, and also in the southern part of the world. Transmission can do easily. So in short, the water is safe for virus, but social distance should be used during swimming anywhere.
Okay. So, doctor, we know that some patients are asymptomatic. They don't have any symptoms, even though they have the virus. And we know that some patients get very sick. So why is that? And what is the difference between these two patients? Why some people get it very serious illness, and others with they don't even feel that they have the virus?
Mm-hmm. The first reason is the status of each individual. Mm-hmm. The immune system of individuals is very important. If you have chronic disease, your disease severity can be higher than others. The second is the amount of the virus. In your first question, I say that this is an airborne infection. No airborne droplet infection. And if the drops include too many virus, your disease can be severe. For example, if you take only several hundred virus, you can be asymptomatic. If you took millions and millions virus, your disease can be severe more than others. So asymptomatic, yes, there is a risk for transmission with asymptomatic patients, but they haven't got any sneezing or they haven't got any coughing, so the transmission risk is lower than others. Mm-hmm. Also, in short, the status of immune status of individuals is very important, and the amount of the virus which transmit to you is important for severity of disease.
Okay, doctor. So what is the incubation period of the virus, the coronavirus, I mean?
So the incubation period is start from 2-3 days to 14 days in our clinical practice. And we have more than 2,000 patients, just I follow up them. Actually, the real time is 7 or 8 days, more than 90% of patients. There are some research that it can be along to from 2 weeks to 3 weeks, but the transmission rate is very, very sudden decrease after 2 weeks. So in practice, we accept that it's 2 weeks, 14 days. Because of this reason, we use quarantinas for 2 weeks. In short, it starts from 2-3 days and it's along to 2 weeks.
So the percentage of spreading the virus after 2 weeks is very low.
Very, very low. We can say it's zero in practice. Very low.
And doctor, how can we distinguish between, you doctors, I mean, how can you distinguish between COVID-19 and other respiratory diseases like influenza or pneumonia or any other?
Actually, this is the most difficult question. Nowadays, yes, we have some not serious virotic infection, but I know that in autumn, in September and November, we wait many virotic disease quite like COVID-19. So yes, in primary care, this is not easy. But there are some clinical science differences. For example, in COVID-19, the weakness is very, very severe when we compare influenza. In influenza, fever is more higher than COVID-19.
Okay.
For moderate and severe patients, COVID-19 respiratory symptoms, especially short of breath, is serious than influenza. But in some influenza patients, the short of breath severity may be more. But for hospitals, for further investigations, we have some more powerful science and clinical data. In lung CT scans in COVID-19, there are some very significant viewing, very significant findings on CT scans. And also we can use some PCR sampling for COVID-19 and also for influenza. In short, in primary care, it's not easy, but in any suspicion of COVID-19, we use lung CT scan to differentiate COVID-19 from other virutic or bacterial disease.
So it's not only testing, you mean you need further investigations to be sure
yes.
that it's okay.
Yes, I know it's expensive and I know in some countries it is not easy. It's not easy to reach these opportunities, but this is clinical reality.
And what are the treatments available now for COVID-19 patients? We heard about lots of antiviral medications. What do you think about it? Which one works? Which one doesn't work? What are you using in your hospital nowadays?
Yes. For drug research and for algorithms, 6 or 7 months is not enough. I am a doctor in practice and I am also a researcher in university. So I know this, but this is a pandemic, so we haven't got time. And because of this reason, I know that we researchers confused all population. Some countries say that this algorithm is good, the other ones say this is not good, this is good. But in Turkish practice, I think it is very important because our mortality rate is lower when you compare the other countries. And also our intensive care unit usage is lower than in many European countries also. So I think our practice look good. We use hydroxychloroquine in first step. Everybody knows that this is some parasites drug, Plasmodium drug, and also we use antiviral agents very early. In Turkey, we use favipiravir, and it's also good. And in United States, they use remdesivir, and also in their practice, it's also good. I think 6 months later, we told that we will say that you can use antiviral agent, one of antiviral agent.
Okay.
In severe patient, we use stem cell treatments, and also in some severe patient who has cytokine storm, we use some specific drugs.
Okay.
So in practice, we say that there is no disease, but there is patient. In our practice, we use similar things in first step, but for more severe patient, we should use antiviral drugs and some sophisticated treatment. We have too many research about this. Maybe 2-3 months ago, we can say that we have some new additional treatment.
So we read about many research talking about the treatment with the respiratory machines for severe cases. And they were saying that it's doing more harm than good to some patients. Is it true? Or what do you think? And when should we use it?
Yeah. If you want only one word, yes, you are right. Why? Because if you refer your patient to intensive care unit very early, it's not true. In our practice, we use high dosage oxygen. In second step, we use high flow oxygen techniques. And then at the third step, we use mask ventilation. If we can, it's not work, we use an intubation.
So
because
you avoid as much as possible to use
yes, because when you intubated patient very early, it is not easy to take out the device from this patient. And also there is some risk of this kind of treatment, because with this kind of ventilation, you give higher pressures. And so this higher pressure is not good for lung health. Because of this reason, you should use a stepwise approach for this severe patient. The intubation, mechanical ventilation is the last step, not first or second step.
Okay, so what are the prevention measures taken by your hospital during this pandemic?
Yeah, so when we watch TV in the December and read the reports of WHO, we aware about SARS CoV-2, COVID-19, and we learn too many things from China than Italy. So we prepared all stuff for this virus. First is education, actually. Second is education. Third is education. So we educated our staff about virus, about droplet transmission. What about transmission? About mask, about hand washing. We educated our group, our staff. Second, we establish a fast track for COVID-19 patient or patient with COVID-19 suspicion. For example, if someone with a fever come into our emergency department, we use different rooms, we use different hall, we use different lifts, we use different wards, and also we give service with different staff, which are deeply educated for COVID-19. For other patients, we put control points, check points in front of the hospital doors. We ask, have you fever? First 2-3 weeks, have you any travel abroad? And we check the temperature of our visitors. After then, we give some rules for our operations. We say that for 6 weeks, if there is no emergency for operations, we stop them, and then we give permission for operations. And we use mask during our practice. We use these cotton masks because this is very good. There is 3 layer. You can wash this and you can iron this. And then if there is a confirmed COVID-19 patients, we use specific mask. If we do some very bloody operations, we use specific wearings for this kind of patients. And also, we educated our staff, if you have symptoms of COVID-19, just go to emergency department. You don't go your work workspace. We check them there, and we wait for PCR results. Then we send our staff to their work area.
So, what do you advise a normal person that he feels that he may have COVID-19 symptoms, to stay home, to check himself, or to immediately go to the hospital? If he has mild symptoms, I mean, very mild symptoms, maybe.
Actually, if in pandemic time, in pandemic period, if you have symptoms, you should apply to specific centers or emergency department, because in this disease, even you have mild symptoms in very short time, not all patients, very small percentage, 5%, these symptoms, the disease can increase suddenly and make you very worse, make you worse. And so because of this reason, contact a health specialist is very important. But if you haven't got any symptoms, because the pandemic periods, there is also, we talk in each other with my colleagues, there is a fear-based medicine, not evidence-based medicine, fear-based medicine. If you just fear from COVID-19, please don't occupy the health service. You can wait. But if you have fever, if you have cough, if you have a weakness, you should go to hospital.
So we know that Acıbadem Health Group is conducting a study with the cooperation of Acıbadem University about SARS-CoV-2. Where are you from this study now?
Yeah, so we have very powerful cell biology laboratory and stem cell laboratory here. And also our university staff group, researcher group is very powerful. There are too many tough researchers there. We are studying for some inhaled drugs for treatment and also for support patient with respiratory problem. Second, our biology and stem cell group work for vaccine. And actually our colleagues produce vaccine for COVID-19, and we have some research for this, and we hope that end of this year we can use this vaccine. This is a speculation, I know, but we are research about, our group research about this. And also we have some research about artificial intelligence, because you asked me, how can you differentiate the influenza and COVID-19? We try to find a questionnaire, maybe a artificial intelligence questionnaires to differentiate COVID-19 to others, and we want to help to primary care. So we have some research, all of them confirmed by Turkish health of ministry, because in Turkey you need confirmation for all research in medicine area.
So you think, is it possible to be able to get a treatment for COVID-19 before the vaccine? It's easier to have.
Yes, it is possible. Vaccine is very good for each virotic disease, but the characteristic or RNA sequence can be changed following years, maybe following months. We have SARS virus, we have MERS virus, now we have COVID-19, maybe COVID-21, COVID-22. We don't know future.
Hopefully not. So in your practice, do you see that the virus is getting weaker with time, or is it getting more aggressive?
Actually,
is it
aggressivity is reduced day by day. Because in first 2-3 weeks, we have very, very severe patients. Nowadays, the COVID-19 prevalence is increased in Turkey, but the severity disease is lower than first time. But in Turkey, we have very strict restrictions, especially first 6 weeks. Maybe this can result to this situation, but in a clinician like me, the severity looked at decrease day by day.
And how do you evaluate the response of the Turkish Ministry of Health to this pandemic?
They did good work, I think. And the system, they established software system, they do test free of charge, they give drugs free of charge, and the Minister of Health has very good advisory board. They listen to science, okay, and so they work, they do good works. Nowadays, after there are some economical issues, and we need to work for future, and so we are Mediterranean people, and when they saw the sunshine, everybody I say that just sprayed to house, to parks. It was risk, but the Minister of Health do good work.
So how do you see the end of this pandemic, doctor? How do you see the end of it? Is it possible to be, or is it possible to get a second wave, as they all are saying?
Actually, we will win this war. And yes, it is possible second, maybe third wave of this pandemic. It's normal, but we are ready. We are more ready than first wave.
And what are the advice you give to people now that are we know that all countries in the world are starting to open up again. So what are your advice to people now?
We save our social distance. It's very important. Washing hands, it's very important. If you have some symptoms, you should be isolated. It is important. And week by week, we can control virus. I think we can control virus better. Actually, these 3 things is important. Through isolation, social distance, and we should clean or wash too much. And fear is not good. If you fear too much from virus, you cannot control your you can lose self-control if you fear too much.
maybe it will also lower your immunity system also if you are at fear all the time.
Immunity system is very important. If you should sleep well, you should drink too much water, because you every time wash your upper airway with this water, and you should eat regularly good things, and so fast food and the meat and foods which prevented by antibiotics is not good. So in Turkey we turn to natural and traditional food in this time. It was good for our immunity.
Mm-hmm. And what about traveling now that the airports will open also? Do you advise people not to travel, or is it safe to travel? What do you think?
It depends to airline companies. They should measures very strictly. Mm-hmm. So using mask and decrease the concentration of the passengers, very important. Mm-hmm. 1 year ago, in a plane, there are 200 200 passengers. It's not good. At least 6-7 months, they should be used strict measures for control.
Mm-hmm. At the end of this interview, Doctor, what would you like to say? Give some hope to people out there against this virus.
First, the health army is powerful and experienced. So we have drugs, and we have good health service, and if we listen and practice measures, we will win this war. If it's a war, we will win this war, and in short time, the pandemic period just pass away.
Great. Thank you, Doctor. It was a pleasure having you with us. You gave us so much information, and we hope to see you again soon.
Thank you. Thanks for the invitation and share this time.
Thank you very much.
Thank you.
Bye.
Thanks a lot. Bye-bye. Bye-bye.